Friends, welcome to my channel. Today we will discuss about role of ultrasound in finding the gallbladder pathologies. Ultrasound is a very useful tool in finding such cases, and it is very non-invasive and easy to use in finding the pathologies related to gallbladder. In this video, we will discuss about how the stone appears, how to find the calculus and polyps and some other cases during that we encountered in the course of our clinical practice. So let's start with the case. This is the case one in which you can appreciate that this is the gallbladder, clearly a distended gallbladder. These are the multiple fine calculuses and acoustic shadows are not so visible in this case. Here you can find acoustic shadows. These are the multiple fine calculus, size are subcentric calculus. So this is the common case, and now we will move to jump. This is the second case. In this case, we are seeing that the distended gallbladder or a normal gallbladder perineal, and there is a single calculus giving a strong posterior acoustic shadowing, and the single calculus is being found during ultrasound exam of this patient. This is the case of single calculus. Here is another case in which we are seeing that these are the multiple calculus giving posterior acoustic shadowing, strong posterior acoustic shadowing, and the gallbladder is not filled pro properly with the stones. In such type of cases, it is very important to note that we have to look the CVD also. Whenever the calculus is very small, we have to look the CVD also. The possibility of a stone getting impacted in the CVD is very common in such type of cases. So whenever we encounter such type of small calculus, multiple calculus, so the chances of finding a stone in the CVD are more. So very carefully, whenever we see this, you see this type of case, don't forget to look at the CVD. This is another case in which there is a large calculus giving a posterior acoustic shadowing. Along with these are the echogenic content present in the gallbladder. These echogenic contents are nothing but the sludge that is present. Sludge with calculus is found in this case, distended gallbladder with sludge and a single calculus giving posterior acoustic shadowing. Posterior acoustic shadow is very important whenever we defined a echogenic content present in the gallbladder, whether it is a stone or polyp. Polyp we will discuss later. We will see the polyp cases also. So let's move on to the next case. This is this is a very important thing. Usually in routine practice, sometimes it may be missed out. Whenever we found a distended gallbladder giving a highly suspicious of calculus impacted at the neck. So in this case, we are saying that this is a distended gallbladder, and we have to look carefully at the neck of the gallbladder, and we are seeing this. There is a calculus impacting. There is a calculus we are seeing here. There is a calculus getting impacted at the neck of gallbladder. So the distended gallbladder with positive Murphy sign, or the patient is complaining in the pain in right hypochondrium, and in ultrasound we are seeing there is this gallbladder is distended. So don't forget to look at the neck of gallbladder. In this case that we are seeing, there is a impacted calculus here it is a calculus that is impacted at the neck, and that is causing flow of bile from gallbladder to the. This is the painful condition, and sometimes patient present with acute pain, acute abdominal pain in the right hypochondrium, and with positive Purpose sign and probe tenderness is found. So distended gallbladder, whenever you found a distended gallbladder, don't forget to look at the neck of the gallbladder. This is another case. This is a distended gallbladder, and we are seeing at the neck there is a, here it is clearly visible. Some small calculus are present at the fundus with along with the sludge and the distended gallbladder. This is the calculus. Small calculus are present at the fundus, distended gallbladder, and there is a calculus present at the neck. There is a calculus present at the neck. Okay, so these are also not a uncommon finding. These are very common. So the point of to remember here is that whenever you found a distended gallbladder, don't forget, look at the neck very carefully. The possibility of finding a calculus at the neck is are getting more in such type of cases. So we have seen the calculus so many. This is another common clinical finding in which we usually found echogenic small focus present at in the lumen of gallbladder. So whenever if we see this type of cases, we have to look whether it is giving a posterior acoustic shadowing or not. If it is not giving a posterior acoustic shadowing, though, so this is not likely a calculus, and we have to move the patient from supine positions to right or left decubitus position, and see whether it is moving or fixed. So usually polyps are fixed without acoustic shadowing. If there is a posterior acoustic shadowing, it will be a calculus. If there is not a posterior acoustic shadowing with mass is not movable, mass is sessile, and it is not movable, so possibility of polyp is more likely the diagnosis. Another important finding in case of polyp is we have to look at the feeding vessels. Okay, in this case it is not shown here, but we have to look carefully at the feeding vessels. Polyp will definitely have a feeding vessel. If the feeding vessel is found, the diagnosis of polyp is very confirmed. This case that you are seeing in the video is a case of gallbladder polyps. The feeding vessels, I am unable to make a video of that. This is another case, polyp case second. These are the fixed mass present attached with the wall of the gallbladder without giving any acoustic shadow. And acoustic shadow is not there. And the feeding vessel, we have to look for feeding vessel. These are more likely the polyp rather than a calculus. Okay. So these are the mass, fixed mass present, echogenic content present in the gallbladder that is not moving, and without acoustic shadowing is more likely a case of polyp. So there is a very important case. So here the gallbladder is, you can appreciate the gallbladder is extending from here. This is the gallbladder. The whole is the gallbladder, and its echogenicity is comparable with the liver. This is the distended gallbladder. Echogenicity is comparable with the liver. So liver, the echogenicity is due to presence in very significant amount of sludge. The sludge is present, and sludge is due to the impacted calculus at the neck. As we discussed in previous slide, that whenever distended gallbladder is there, we have to look for the neck. A calculus is more likely to be found here in such type of cases. Along in this case, interesting point is that the sludge is present, sludge is filling the whole gallbladder, and it is more likely resembling with the liver. The liver resembling with the liver is, this condition is described as hepatization of the gallbladder. So hepatization of gallbladder is nothing but the echogenicity of the lumen of gallbladder is more comparable with the liver. It appears like a liver. So there's two important things to be noted in this video is that first, the echogenicity that is comparable with the liver. It is called as the hepatization, and this condition is more likely due to impacted calculus at the neck. This is the calculus present at the neck, and the impacted calculus is causing this distension of gallbladder and hepatization of the gallbladder. Now, there is a very important finding. We will see the video in next lecture also. First, let me describe this case. If you found a such type of condition in the place of gallbladder, you are unable to see the gallbladder. what we are seeing that this is a clear line that is more likely the wall of gallbladder with echoes present below the wall. These echoes are nothing but the echoes from the stone, but the stone are present in that sufficient amount that there is no space left that is free from acoustic shadowing. There is a very strong acoustic shadow. So the first is the wall, second thing is the echoes, and then is the shadow. Wall, echo, shadow. This is called west sign. A west sign is indicating that the gallbladder is filled with the multiple stones and surgery is supposed to be advised. So there is a no here in this case you are seeing that there is a clear wall. Below the wall, there are some stones, and below the stone, there is a posterior acoustic shadowing. So this is wall echo shadow. Wall echo shadow. That is west sign. West sign is giving us an idea about the stones are present in surplus amount that the gallbladder is filled with multiple stones. Okay, so in this video, we will try to explain that we discussed in the previous slide that there is a wall, clear cut, there is a wall of gallbladder. Here there is a wall of gallbladder. Behind, below the wall, these are multiple stones. There's a shadowing thing are present in the gallbladder, and below the shadow there is a strong shadow. The echoes below the echo there are a strong shadow. So ball echo shadow. This is a classical example of Weiss sign. Weiss sign is indicating that the gallbladder is filled with the multiple gallbladder. So we in this video we discuss the some common findings of the gallbladder. This does not include all the findings. So maybe later on in this channel I will try to explain and I will try to discuss about the more possibilities, the mass and the new plastic etiologies of the gallbladder that may be discussed in the later videos. Thanks for watching the video. If you have reached up to this point, please don't forget to subscribe and like our channel.